do right here.
I'm gonna see myself, but I can't watch myself.
Oh, but I need to
over
mute
No.
this. Oh, it's muted. Okay.
there. Okay. Don't watch myself.
Yeah, is yours muted?
Okay.
If you're gonna get on
You're live.
Facebook.
Hi, good afternoon, good evening. I'm Eric Sergienko. I'm the County Health Officer here in Mariposa County. I am really excited that you're able to join us for this Facebook Live. I honestly don't know how it's going to work, but I've got people that are monitoring questions from,
Go ahead.
oh, and we're already fixing one thing, so stand by one. And
It's a little lag.
okay, there's a little bit of lag, so hang with us. We're trying to fix that. Don't turn your computer screens. So a lot has happened in the last week, and actually since Tuesday, since I put out the YouTube video, and I'm glad you're able to join us. I'm sure you've got questions because I have a bunch as well. And so I'm just going to start with a really brief update on some of the stuff that's happened between Tuesday and today. So I will say the biggest thing throughout not only California but the West Coast and other states is some level of governor's order, regional order, health officer order has been issued for canceling or postponing large-scale events and mass gatherings. This has happened very quickly. We were given a heads up on it Wednesday night in Washington and Oregon. The governors issued health order or executive orders closing mass gatherings. In California, the governor elected to do that slightly differently, passed that authority to the state health officer, Dr. Sonia Angel, who delegated it down to the local level. And essentially the guidance is to cancel or postpone any event that is more than 250 people. And if you've got an event that's smaller than that, what we ask is that you have some mechanism to do some social distancing. That may be difficult, but we feel like there's some play in that. And then really the most important part of the guidance from the California Department of Health and from CDC is protecting our most at-risk population, and that's our folks who are 60 and older, and we know that is about a third of our population here in Mariposa. And what they're asking us to do is limit gatherings of those population, those folks, to less than 10 and ensure that social distancing is taking place. So in order to have that happen here in Mariposa and in other counties, we've declared a local health emergency. I'm doing that using my authorities under the Health and Safety Code, and then wrote a health officer order that states specifically that guidance. And so that's been posted on our Facebook. It's being shared on other county Facebook pages right now, so feel free to look at that. I am concerned about the economic impact that will cause, but at this point in time, given what we know about COVID-19 and the spread of it, we feel it's a prudent measure to decrease the spread, knowing that different parts of California are in different parts of the epidemic curve. That is, more transmission happening in other places. We here in Mariposa have not seen a case yet. We've had 3 negative tests so far. We have several tests that are pending. And so we're waiting for those results. And we're looking forward to, again, one of these days, one of those tests are going to be positive. But I will say another thing that has changed in the last 5 days is we've been able to test more people as more testing has come online. Up until Monday, we had been relying on our public health laboratories. Those are very low capability in terms of our low capacity and the number of tests they can run, very good capability, and that you know that the results you get from them are solid. That has expanded now to include commercial labs such as Quest. So Quest can do lots of labs. At the beginning of this week, they could do 1,200 tests for the state of California, and then by now they're up to 5,000 tests, but again, that's 5,000 tests for a population of about 33 million. So we're looking at increased testing. I'm getting a lot of requests from providers to do testing, and I've said yes to all of them. So I think that'll be something, again, as we do more testing, we're more likely to get a positive, but that's to be expected with the spread of disease. So the last thing I'll say before I open it up for questions is as we're looking for disease, we are still in what's called a containment mode. We're looking at containing that disease, and like I said on Tuesday, what we'll do with those positive results is isolate that individual, quarantine the contacts around that person, and that'll slow the spread of disease. The reason for that is we want to prevent what we see in Italy right now, where you're seeing ICUs overrun with patients where they're making decisions about who goes on a breathing machine and who doesn't. By being able to contain the disease early on, we flatten that curve. We decrease the demand for healthcare services, and that will be critical for us. It'll make the difference between what we're seeing in South Korea and what we're seeing in Italy. So with that in mind, I'm going to open it up for questions. And Christina here next to me is reading questions off to me.
Yes. Okay. So the first question is from Don, and he says, I keep hearing that it only started earlier this year, but I had also heard that it had been around in China since November. Earlier today, Dr. Amesh, senior scholar, Johns Hopkins, Bloomberg, stated on Meet the Press Daily regarding the current state of testing. The CDC's guidance initially said said only test people if they've been to China. We knew that this has been spreading at least since November in China. Can you please comment on that?
So two different questions is one, do we really know exactly when it started? And the answer is no. We do know that the first case that presented in Wuhan, China, retrospectively was identified on the 8th of December. And we kind of know from genetic analysis, looking at the virus itself, it was probably in the community somewhere around that time and maybe a little bit before then. The cluster of cases in Wuhan came to the attention of the world on New Year's Eve when the Chinese government, through their Center for Disease Control, made a statement to the World Health Organization that they had a novel coronavirus that was spreading amongst their community in Wuhan. So that's kind of the timeline of disease. Is we really, as a country or as a world, were aware of this on New Year's Eve, that there were 41 cases of an unusual pneumonia in Wuhan, China. Getting to your second question about lab testing is yes. And what happened in a little more detail is the CDC developed a laboratory test that was 3 parts. They sent it out to the public health labs while at the same time we're developing a commercial test. And when they sent out the 3-part test, it turned out that third part, what was called the M3 reagent, was fragile and somehow in shipping, degenerated and wasn't able to work. So in short order, what happened is that the CDC and the FDA modified the testing so it only needed the first 2 parts, and so that allowed the state labs and the regional public health labs to go ahead and move forward with that test.
Okay. The next question is from Alyssa. Is it true that everyone who wants to be tested will be tested?
So the answer to that is no. But that said, is what we would say is that every clinician who asks me to do testing or who goes to Quest and requests testing will be approved. So if you go see a doctor, go see a nurse practitioner, go see a physician assistant, they can order that test if they feel it's warranted. That said, what we have seen so far in Mariposa is all the tests that we have received results on have been negative, and we've also seen alternative diagnoses. So if someone, say, goes in and sees their doctor and says, I need the COVID test, it might turn out that what we'll do first is a rapid influenza test. If that flu test is positive, we know that the likelihood of what's called a co-infection, that is having COVID-19 at the same time you have influenza, is less than 2%. So it's more likely you just got that single infection, and it's better for your provider to treat that single infection than try to chase down something that's far, far less likely.
Okay. The next question is from CL. If you get a positive result, what does the person have to do?
So if we have a positive result, if that person is in Mariposa right now, which is we're still in containment, is that person would be isolated until 7 days after the first symptom they had, or 3 days after their fever broke, whichever was longer, so that's their isolation period. And then any of their contacts, which are people who would be in close contact with that individual, would be in quarantine for 14 days. Now, that said, if I put you in isolation, if I put you in quarantine, we will take care of you, make sure that you have the things you need to be in your isolation or quarantine. And so that's a tough thing to do, but we feel it's an important civic thing to do to ensure that we slow down that spread of disease. Now, if you're gonna have a positive in what's called a mitigation area, that is where we're outside of that containment, it just means you need to take care of yourself and stay at home until you're 24 hours out from your fever. Now again, we're not in a mitigation zone. Those are California counties that are to the north of us, like Placer, Sacramento, Yolo, etc. But if you were to be here in Mariposa and have a positive test, again, isolation and quarantine.
All right, so the next question is from Sarah. Who is most at risk in getting the virus?
So one thing that's important is this is different than influenza. What we know with this disease, with the coronavirus, is that it spreads more effectively in adults than in kids. When we were planning for a pandemic, we were planning for a pandemic influenza. And influenza spreads really well in kids all the way from neonates up into the teens. What we've seen with the coronavirus is that it mostly impacts adults from 18 to 64, and that our most at-risk population are those folks who are from ages 60 to 80. I will click it on me. So we're playing with the sound. Let us know, and we've got people that are looking to see if our sound is good. So I've got a thumbs up. We're doing well with sound. So hopefully you're hearing all of this. Next question.
Okay, next question is from Susan. Are there talks of closing the park?
So I have been meeting with the park, and I'm going to defer to them. And again, that's actually one thing I really want to point out for our listeners in the park, is that the park is actually federal exclusive jurisdiction. So my health officer powers don't extend into the park. But I am in close conversation with the chief ranger and with the public health officials that work in the park. At this point in time, there's no talk of closure there, but what I've asked them to do is kind of align with the guidance that we've gotten from the California Department of Public Health and look at those events that are large-scale events and see if they can cancel them or modify them. So again, in conversations I've been with the park on, no talk of closure to date.
Okay. What if you don't run a fever because you are immune deficient?
So good question. So the question is if you have symptoms, and if you go to your provider, again, you don't need a fever at this point to have a test. We know that for about 40% of people who have gotten a coronavirus is they have not had a fever. The key feature that we want you to keep looking for is what's called the dry cough. So if you're coughing something up, if you've got sinus congestion, it's less likely to be coronavirus. A dry cough with shortness of breath are the two key features that we're looking for. Fever is number 3. So again, doesn't rule you out from getting tested, but it's less likely to mean that it's actually coronavirus.
Okay. Next question from CL. If I get my health care in a different county but live here, do you get notified if I have a positive test?
Yes, we do. So if you're a resident of the state, or correction, of the county, you get the county results come back to our public health nurse. So say you get tested in Oakhurst, we would find out about those results when they got resulted from either a commercial lab or the public health labs.
Okay. Next question from Susan. So if you are over 70 and have a recent untreated sinus infection, are you even more at risk?
So 70 is definitely a concern. So again, that age group of 60 to 80. Sinus infection, hard to say. Most sinus infections are viral in nature, but can become a bacterial infection, can weaken your immune system. But most people with minor sinus infections do okay, and it's not been shown as a risk so far. It's more chronic diseases like heart or lung problems.
Okay, what is the difference between COVID and the flu?
All right, we talked about that a little bit, but again, influenza mostly spread in kids, coronavirus mostly spread in adults. It's hard at the beginning of onset of symptoms, maybe to tease them apart. And so more often with influenza, you have a sore throat. Oftentimes you have a productive cough. And then what we've actually seen this year with influenza B is, oddly enough, diarrhea, nausea, vomiting. Doesn't typically happen with influenza, but we're seeing it this year with the flu B.
Okay. Evan asked, oh, maybe he missed it, but are there any known cases in Mariposa?
So again, no known cases in Mariposa, and maybe as long as I've got folks wondering about that, is that we do have cases in adjacent counties, in Madeira and Fresno, and those are what are called travel-related cases. They are both related to travel on the Grand Princess, which is a cruise liner, and they were actually notified shortly after they got off the ship that they may have been in contact with coronavirus patients, so they quarantined themselves, and then when they developed symptoms, they quickly called the health department, quickly got tested, and were able to be isolated and quarantined. So we're still in those counties looking at community transmission. Another place that you may have heard of is Copperopolis up in Calaveras, so that's the nearest case to the north of us. A healthcare worker was notified by his employer that he was exposed while working in the Bay Area, and so he quarantined at home. Unfortunately, and this is probably something that's worth knowing if we get to the point where we're having you self-quarantine, is that he quarantined, but he didn't exclude himself from his other family members, and so he ended up infecting one of his children.
All right, Barbara would like to know, what level of respiratory support does JCF have? In other words, how many simultaneous people can they give critical respiratory care to before they will be overwhelmed?
So when you use the word critical, and that you think of critical care or an ICU, John C. Fremont as a critical access hospital actually does not have an ICU. That said, we have been talking at length with the emergency staff there, and we do have the knowledge and the skills to run ventilators, and we feel like there is the potential for having our community, having our region at a point where we would need to do ventilators here at John C. Fremont, and we feel like we could run 4 ventilator patients up here comfortably.
Okay. Bobby Joe would like to know, should pregnant women be worried because their immune system is not as strong?
So, good question. What we do know from data from China is that pregnant women, pretty much the same as the general population, is that they have mild cases and recover well, and do not have the same experience we had. I don't know, probably don't remember the 2009 pandemic of H1N1 influenza, but for that outbreak, we did see a difference in how women that were pregnant did. But again, with the coronavirus, we don't see that difference. We see that they're doing as well as the population as a whole.
All right. Are all large local events in the near future canceled?
So the health officer's order aligns with the guidance that we got from the California Department of Public Health, and that says that large events are canceled between today's date and the end of the month. But the proviso I put in the health officer's order is if we get guidance from the state or from the federal government that we need to extend that, that is something that could happen. But for now, it's just for the next 2 weeks to see what the impact will be, not just for us, but the entire West Coast.
Okay. And Jim would like to know, I see Fresno schools are closing. Will Mariposa schools be closing?
This is an awfully good question. For those of you who are in the know, I'm the acting health officer for Tuolumne County as well. And so I've been on a lot of phone calls today, yesterday, the entire week with both school superintendents. And really our intent is to keep the schools open as long as possible. There was a guidance that came out from the California Department of Public Health that all the local health officers contributed to. And if you look at that, it has 4 different scenarios. And we're in scenario number 1. That is, we don't have any cases in the county. So we're taking prudent measures to get ready for cases. So cleaning high-touch surfaces, making sure there are options for telework and for teleeducation, sort of building the capacity to be ready for when we close. When we start seeing cases in the schools, we would close a single school until we had community level transmission, and then we may consider closing the schools. Now again, sort of our playbook on school closures was based on pandemic influenza. And again, influenza spreads easier in kids. With coronavirus, there's not going to be that ability to spread the virus in the schools like we would with influenza. And so the real reason for closing schools is just to slow transmission. If it's not happening, then the benefit of keeping schools open, whether it's for education purposes, whether it's a place that kids go to while parents are at work, or whether it's for the third of our population that receive free or reduced price meals, and that may be the best meal of the day they have, there are reasons for keeping the schools open. Now, in talking with all the other health officers that have been involved with school closures, only one of them has been supportive of school closures, and that's in an area where they have slid from containment into mitigation. And so, from a public health standpoint, there really isn't an indication to close schools, especially in Mariposa right now. But we're monitoring it. We're in close contact with the schools. I feel comfortable with the decisions we've made so far.
All right, the next question comes from Sarah. Are there any plans for travel restrictions?
So for us as county employees, we put some guidance out there that there will not be travel to any places that are in what are called the mitigation counties. That is on the map that is on the CDPH, and actually it's right behind me. Those areas that are in the light blue are areas that we as county employees have been advised not to go to. And so there's that restriction, but as far as restrictions for general citizens, no, not that I know of.
Okay. Next question comes from Joyce. What about county offices and like the courthouse or human services?
Okay, so read that one again. What about?
I think she's asking about closures.
So at this point, no. Our intent is to keep places open as long as possible. Now that said, we're looking at what are our essential functions. What are the things that we need to provide as a county government? So courts is definitely one of those things, and we've been working with the courts to do things like, could they do it through video teleconferencing? How do we create social distance in that space so you're outside a droplet range so that one person doesn't have the potential to infect another? So moving services to online or by telephone, moving around shifts, so we may open early, stay late, but have 2 different shifts. We're exploring those options, and we'll let you know things. One thing I will let you know is if you are sick, we ask that you don't come in and ask for services, because again, we don't want you spreading an infection amongst not just the county employees, but everybody else.
Okay. Really quick, can we read off these counties for them?
Sure. And I will say there's one county that's missing from this, and that's Placer. And then you come from east to west, it's Sacramento, Yolo, Solano, Contra Costa, Santa Clara, San Mateo, and San Francisco. So those are the areas where the counties have said that they have gone from containment into mitigation. Oh, and I always forget about Riverside. It's always there at the south of the, so.
Okay, thank you. So CL asks, does staying in shape, aerobically, getting adequate sleep, and eating a nutritious diet provide any protection for a generally healthy person who is over 70?
Yeah, so your baseline health will dictate how well you do. But that said, that 60 to 80 group is still kind of at a risk. You're probably as an individual at less risk And so it's hard to tease out what are the individual factors that make you more resilient against this disease. But yeah, staying hydrated, resting, being aerobically fit will potentially make you less vulnerable to this disease.
All right, Susan wants to know who's going to notify us when there's a confirmed community transmission case.
That'd be me. So again, my role as the health officer, now actually the folks that are with me are what we call the Joint Information Center team, or the JIC team. And so it may be me getting in front of the camera like I am right now, but if things are busy, I would rather have them notify you sooner, get that word out about a case, whether it's a community transmission, whether it's a travel related, whether it's a healthcare worker, regardless of what type of case it is. When we have our first positive case in Mariposa, if it's one of our residents, you'll hear it from us as soon as I can get that word out.
All right, Susan would like to know, can you address social distancing in situations such as interview rooms at HHSA?
So good question is, again, social distancing is, I'm going to step outside the camera, is really a little bit more than arm's length distance, somewhere between 3 to 6 feet. So within the interview rooms at Health and Human Services specifically, my understanding is they actually have created some social distancing so that you're a little bit further away than you used to be. But I'll go ahead and confirm that, but within all of our spaces, you should be farther apart than Christina and I are.
Okay, Barbara would like to know, there is confusing information regarding N95 masks. Are they helpful? What are their limitations?
So N95 respirators, and I think it's important to call them respirators because they're not just simple masks, are effective in reducing your exposure to this disease. So N95, the 95 is what the percent of fine particles it removes. And they're focusing at the 0.3 micron size because that's the thing that's hardest to filter out. So it does reduce your risk. But what we're asking people to do is limit those to healthcare workers because we know there's a short supply of them and we want to save them for those people who need them the most that are in close contact with ill individuals. So those are the N95 respirators, and again, we have an adequate stock up here in the county to keep us going through operations for quite some time. Those are in contrast to surgical masks, and again, what we ask people to do is use those only if you're sick because they aren't effective at filtering things out. They're effective at stopping droplets from coming out of your mouth or your nose and getting caught in that and spreading disease. So we ask that you save surgical masks for those people who are ill and need to cover their cough.
All right. Kathy would like to know, what is the turnaround time on the lab?
So the quickest turnaround time I've had is about 26 hours. And we've had up to around 96, so it varies, but they're getting better at it. So I think as we get things smoother, the turnaround time will be consistently between 24 and 48 hours.
Okay, CL says, there are 2 related cases in Copperopolis that I heard about. Do you know if they are travel related?
So I talked about that just a bit ago, but I'll reiterate that, is that the index case, if you will, in Copperopolis was a healthcare worker in the Bay Area, so from one of the areas where there's that transition from containment to mitigation. He was taking care of a patient not knowing that that person was positive for coronavirus, went home back to his house in Copperopolis, received notification after he returned to Copperopolis that his the patient he was taking care of was indeed positive for COVID-19. At that point, he had not yet had symptoms, so he isolated himself, and then, but what he did is he also kept his family with him and quarantined them, didn't separate the families from himself, and he ended up infecting one of his children that was in quarantine with him. So those are the explanation for the 2 cases there. Again, the Calaveras County Health Department has been able to do contact tracing of all the people that were in with that family and have been able to quarantine them.
All right, Jim would like to know, are first responders taking a different approach on calls?
So I will say this is a work in progress, and we are continually improving that process, is that the intent is that Our emergency medical dispatchers who work with us and are based out of the CAL FIRE Emergency Communications Center do a series of questions that attempt to figure out if this person is potentially a coronavirus patient. And if they get that indication, then they'll give a heads up to the first responders and to the ambulance to don appropriate personal protective equipment. What we've noticed is sometimes that's inconsistently applied, and again, we're providing feedback and making that process better so that our first responders and ambulance staff get the word before they get to the scene and are able to take appropriate precautions. And then cascading from them is they will evaluate the patient, and if the patient is stable, they can discuss that case with me or another on-call person for public health to determine whether that person fits within the testing criteria for coronavirus. If that person is ill enough that we need to move them to a tertiary care center, we'll have the ambulance do that for us and then test the patient in that setting. Otherwise, if they're stable, they may come to John C. Fremont.
Okay, Heather would like to know when, if we need to notify the population of changes in our status, will the Nixle system be used? And is there anything that people will need to do that is different between containment and mitigation stages?
So yes, I think we will use some mass notification. It's called Everbridge now because we upgraded from Nixle to Everbridge, and we can do some really cool things with that I would defer to the JIC staff to let me know how we can do it better. But we would do notification, and then realistically, as we move from containment to mitigation, some of the measures that you'd see in place right now would kind of amp up. So the large scale event guidance. We would see more urging of teleworking, more urging towards school closures, things along that lines. But I don't think of it as a light switch as I do sort of a dimmer switch. Is we would look at what the community transmission was happening, where it was happening, and see what we felt was the appropriate mitigation strategies to apply to it.
Okay, there's a couple questions regarding tests in Mariposa. Have there been tests in Mariposa, and are there still test results pending?
Yes and yes. We've had 3 negative tests so far, and I believe we've had another half dozen that are pending at this point. And I say about is because at this point in time, if a provider decides to go through Quest, the commercial lab, to do coronavirus testing, they do not necessarily have to get what's called a person under investigation number. They can get that after they get a positive result. So there may be providers out there that are testing people for coronavirus that we at the Public Health Branch of Health and Human Services don't know about. But we do urge all providers that are considering testing to give us a call, because then we can prioritize the test and make sure it gets the right attention once it gets to whichever lab it gets sent to.
Okay, Kathy would like to know, is it safe to go to Fresno for a doctor appointment, or should we cancel?
So at this point, I would say it's safe. Again, we only know of the travel associated case that's in isolation in Fresno. And so I would say that at this point in time, you are safe in going to Fresno. Again, do those things that you do to prevent influenza as well as the coronavirus. And you've heard me say it before. You know, wash your hands, cover your cough, keep your hands away from your eyes, nose, mouth. Stay away from sick people.
Okay. Renee would like to know, how has the county reached out and provided information and guidance to restaurants, lodging, gyms, and other like businesses in the community?
So yes, our JIC team has done some outreach with businesses, and I've also talked with the Mariposa County Business Association, and as well we're in contact with the Chamber of Commerce and been messaging with them, not only about how to respond to the coronavirus, but we know there's going to be an economic impact associated with it, so how to be resilient in the face of that.
Okay. Barbara would like to know, are those who have recovered or those who test positive but were not symptomatic developing an immunity?
I'm going to have to say at this point, most likely, but I don't know that there's a whole lot of post-infection studies that are out there. We do know that there's not you may have heard in the news about a reinfection, and that was just determined to be sort of bad data. So at this point, yes, we feel like we developed some immunity, but that's pending sort of real in-depth immunological studies.
All right. We're going to keep asking questions for about another 15 minutes, just so you know. The next question comes from Susan. How concerned should we be about such a large number of visitors staying in Mariposa? The people coming to the park are from many states and countries. This seems like it would be a huge increase in risk for our residents.
So again, so far, we have been testing people and we have negative tests, and that's in face of the number of large visitors we have. And I think it's, again, a balance is that if you stop travel to the park, stop travel to Mariposa, you're impacting a lot of lives more so than the disease does. So it's creating that balance. A lot of the things that we can do for decreasing the spread of disease, we're taking those steps right now. Again, canceling large-scale events. I know that's going to be an economic impact, but I feel it'll reduce the spread of disease because we will have people that will not come to Mariposa given that's happening.
Okay, Sarah would like to know if someone doesn't have health insurance but has coronavirus symptoms, what should they do?
So again, we want you to get taken care of, and the governor has waived the testing cost of getting a test for coronavirus. That said, that still doesn't cover all the associated medical bills with that, but if you are sick, we want you to get taken care of. And so what I always tell people is there shouldn't be anyone who isn't covered. If you feel like you're qualified for Medi-Cal, reach out to us at Health and Human Services, to the Medi-Cal folks, calling 966-2000 and setting up an appointment to see if you can get insurance.
Okay, next question from Teresa. What is your suggestion for private gatherings such as parties, weddings, and such?
So at this point, again, if it's a large wedding, greater than 250 people, I would downsize that wedding. If you want to have it at the same date you've got it scheduled for now, it's between now and the end of March. And I'd even think out through the end of April. Again, I've tried to anticipate what the state has recommended, but I feel like the guidance will be renewed and driven through the end of April. So think smaller, and then at those weddings, think about how you can do social distancing. Again, we know there's going to be hugging at a wedding, but again, think about not everyone hugging everybody else. Think about ways to stop the spread of disease. It's tough. And again, that other guidance, don't touch your face. Think about how many times you touch your face in a day. Everyone's making a face here. Okay.
No, my face itches. All right, next question is from Alicia. How likely is it that the schools will close?
Again, just like anticipating when the large-scale event guidance will be lifted or renewed, closures right now, again, for the reasons I've mentioned, it makes sense right now to keep schools open, but a lot of schools outside of Mariposa, outside of our area, are closing. I will say because of staffing issues, because of parent issues, or because of parent concerns, but really there's not a public health reason to close the schools at this point to decrease the spread of transmission. So, getting back to your question, for right now, my intent is to keep the schools open, recommend to the school superintendent to keep the schools open until we start seeing cases in the county.
All right, Cindy would like to know, are they going to close the park?
Okay, I think we asked that or answered that already.
We did.
Again, no indication from the park that they will close it. They do have guidance. They do have an incident management team that's set up to address the concerns about the park.
All right, and Tammy would like to know, have you given any guidance or directives to the youth sporting organizations such as Little League Baseball and Softball regarding suspending play or practices?
So again, the concern here is, can you maintain social distancing in that activity? So broadly speaking, my guidance would be is if you can create social distance, you can keep that event going. But that would probably be difficult at a sporting event. Again, you've got contact sports. Even baseball has some degree of contact. Softball, people sliding into each other, and then you think about the dugouts or where people are gathered. They're all squeezed together. So
My thought at this point is it would be difficult to do appropriate social distancing at sporting events, so I would consider canceling or postponing them.
Okay, and Linda, I think I missed yours, but I see it now. Should those who aren't symptomatic be tested?
So again, we're kind of limited in the number of tests we can do. Even with the ramped up testing, we're doing the numbers earlier today. Even with all the commercial labs ramped up for this, there's still probably going to be a limitation of about 12,000 tests per day in the state of California. So testing asymptomatic people probably won't yield us much benefit. But I will say, to answer those questions about are we seeing a lot of asymptomatic people, is that the CDC, in conjunction with 3 county health departments in the state of California, are doing what's called serosurveillance. That is, they're testing people to see if they were exposed to the disease, and at the same time asking them, hey, did you have any symptoms? And from that study, which we should get results with by the end of the month, we'll see an idea of how many asymptomatic people are out there.
All right. Jeff doesn't have a question, but he appreciates your calm, measured tone and your factual responses.
Well,
and
thank
thanks
you.
you for what you do.
Thank you.
Okay. Are you guys seeing any more that I'm missing?
Not right now.
So we will take questions for about 5 more minutes. If anybody else has questions, go ahead and post them. I'm looking through these questions and I'm feeling like we answered them. What should I do if I am unable to work after being exposed?
So again, that's kind of a question for someone who's not the health officer, but what the governor did over the last, and I do lose track of time, it's been a busy week, but he released an executive order that will allow you to get benefits that waive the 1 week waiting period, and so you'll be able to apply for benefits earlier, basically immediately after you have symptoms. Now the question for me, and I'll take this back to Health and Human Services, is we can't have you come and get benefits or apply for benefits if you're homesick. Can we do that remotely? And again, if you're not able to work, how do we get you set up for benefits in a short order when you can't travel?
Okay, next question is from Kim. Should I rush to the store and buy food and supplies?
So, no. No need to do panic buying, no need to buy out all the toilet paper at Pioneer. But, just like I said on Tuesday, it is important for our at-risk population, so those of you who are older than 60, those of you who have heart problems, lung problems, or diabetes, do lay in a 14-day supply of food, shelf-stable food products, and also have a 30 to 60-day supply of your prescription medications. Like Heather had asked earlier, when will we apply some of these mitigation measures? Well, one of the mitigation measures we may ask folks who are at risk to do is shelter in place, and shelter in place for a couple weeks. So having those material with you, and then being able to reach out to friends or family or other people that you trust to make sure you can get a resupply should that be needed. That would be an important individual plan to work on right now. So again, for people who are at risk, get that 14-day supply, get your prescription medications, set up your communication plan. But for most of us, no, there's no need to stock up stuff.
Susan would like to know, is there any scenario in which all will be asked to stay at home?
So that's what we're seeing in Italy right now. We're hoping that that won't happen, and that's the reason why we're applying these large-scale event and mass gathering closures guidance right now, is that by doing some of these early community mitigation measures, it's likely that we'll be able to stave off that direction where Italy's trying to have everyone stay in their house and avoid the spread of disease.
Dan would like to know, is the Mariposa Board of Supervisors meeting next week going to comply with CDPH guidelines for social distancing?
Yes, I'm going to say yes. So one of the executive orders that was released by the governor today, maybe yesterday, was yesterday, was a suspension or modification of the Brown Act. So our county supervisors, if they want to, can basically phone it in, they can VTC in. And then, given what I know about attendance at the board meetings, is we can maintain adequate social distance. So what we'll have is people that are in the audience at the Board of Supervisors can't sit next to each other, they gotta keep a couple seats between themselves.
Heather is asking for clarification. She says, I heard you respond that yes, it is reasonable to maintain medical appointments outside the county, but just to be clear, is this advisable for older, fragile elders?
Yes, so again, the question was about Fresno. Fresno, there's not people walking the streets with coronavirus. We know they've done a lot of testing down there, and a lot of testing has been negative. So I feel like we've got an adequate understanding of disease transmission in that part of the Central Valley. On the other hand, what I would be concerned about and ask everybody to do is, again, kind of consult this map that's at CDPH and look at where disease is being reported and where the county health officer is saying, hey, we're no longer in containment, we're moving into mitigation. If there's a place in mitigation, I would advise, not just the fragile people, but people who are concerned about acquiring coronavirus from not going there.
All right, Sally would like to know, she says she has RA and is 80. She's expected to attend a large family gathering in Southern California. Wants to know if she should decline probably over 50 people attending.
Yeah, especially if you have mixing of people coming from different locations. You're already immunosuppressed. Again, I'm not your provider, so I shouldn't be providing medical advice. But from a public health standpoint, anytime you're exposing yourself to a mixed population, you're increasing the risk of acquiring a disease. All right, I think we have time for one more question.
One more.
Make it a good one.
Make it a good one. Who's going to get it? I didn't miss it? There was some, if I did skip yours, it was answered previously, so you can go back and watch the answer. I didn't want to
And
make.
I will say the other thing is, if we didn't get to a question, or if you think of a question later, we have answers, and what we'd ask you to do is email us at Mariposa COVID-19, all one word, so MARPOSA-COVID-19 and the Joint Information Team will look at those, and if they get stumped by it, they'll refer it to the public health nurses. If they get stumped by it, it'll eventually come to me. So your challenge is to find the question that will stump us. All right, so the last thing I'll say is we do appreciate your questions. If they can wait for an email answer, do that, send it in by email. But again, we're getting lots of calls. Call us at the health department if you can't wait for an email answer. But we ask that you not call John C. Fremont and ask for the emergency department. They're getting swamped with calls right now.
Okay, the last question came in and it's from Kelly. She wants to know, are there guidelines in place regarding symptoms for healthcare professionals that would deny an ill person an appointment with the clinic?
So not really, but again, the clinics are, and we've had this challenge in educating clinic staff, and again, we want to get people evaluated, if needed, get them tested, and at least here in Mariposa, and I'll say with John C. Fremont, because again, we have other clinics outside John C. Fremont, JCF will see you. They ask that you call first so they can set up sort of an alternate entrance. But again, call early and let them know you're concerned, and let them set up a way to see you. With other clinics, I am less clear, but again, they don't have what's called the personal protective equipment to necessarily evaluate you. So if you call, say, another clinic and say, I think I've got coronavirus, they don't have the respirator, the eye protection, the gloves, the gown to protect themselves. So they may direct you back to John C. Fremont or to another emergency department to get your care.
Okay. That's it.
All right, super, thank you so much. If this was beneficial to folks, let us know. I'm happy to do it again.
And you share the video too so we can get more information out to more people. And remember, we have mariposacovid19@gmail.com.
Thanks so much.
Thank you.